There are fears that the NHS could face long waiting lists once hospitals return to normal. Non-urgent operations, elective treatment have all been stopped during the crisis, and it seems that many people have stayed away from hospitals who should have asked for help. Well, we can talk now to Nick Hume, Chief Executive of East Suffolk and North Essex NHS Trust, and also to Debbie Fleming, Chief Executive of the Poole Hospital and the Royal Bournemouth and Christchurch Hospitals NHS Foundation Trust. Good morning to you both.
Morning.
Good morning.
Debbie, first of all, I think people may not have appreciated just what difference it makes that when hospital staff have to wear PPE equipment. It does slow things down, doesn't it?
Absolutely, and we've seen this in so many areas. Our staff have been fantastic and the hospitals have done so well. But actually, when you're in full PPE, it takes time to put it on, it takes time to take it off, and it takes time to do all the cleaning around each patient. So things can't go as fast as normal.
Nick, what kind of impact do you think it's likely to have on waiting times?
Well, we've seen a massive increase in waiting times because of the slowdown in elective care. So I think waiting times are going to be sadly longer than we've seen in several years, which is so sad as the NHS have done so well to reduce waiting times for most conditions over the last few years. It's going to set us back, I think, significantly in terms of shorter waiting times.
Significantly, are you able to put a time on that?
Well, just to give you some example, we had 4 patients waiting more than 52 weeks as we went into lockdown across our organisation. And as of this morning, we've got over 500. So I think that nobody wants to see the waiting times back at sort of 18 months, 2 years that we saw several years ago. But I think we're going to have to try very hard to keep it below that, frankly.
Are you worried about waiting times as well, Debbie?
Absolutely. I mean, I think the thing we need to be very clear about is that we've done such a great job in prioritising the most clinically urgent cases. So people with cancer, urgent cancer treatments, those sorts of things, we have managed to still bring patients in. But like Nick, we are all concerned that the length of time that people are waiting for more routine operations, that's not where we want to see it at all.
But has remote working offered any opportunities at all, Debbie?
Definitely. I mean, one of the things in the whole COVID pandemic, which has been so dreadful, we've seen masses of transformation across the NHS in the way that we work in our hospitals and out in the community. Loads more remote working, outpatient clinics done by video conference, done by telephone. And this has been a great success story, and we want to hold on to those things going forwards. But of course, we do still need to bring patients in for diagnostic treatment, diagnostic care, and also to treat them, to operate. And it's those things that we're working now with partners as well and with the independent sector to maximise all the capacity that we have to keep waiting times to the minimum.
And Nick, that has been an issue, hasn't it? Both people being unwilling to go into hospital because they're worried, people who might need treatment, and also people who just have had their appointments cancelled.
Yes, it is a concern. We have seen people presenting quite late, particularly with cancer, and therefore the prognosis is significantly worse. So we are encouraging people. It is safe to come to hospitals. We've got good PPE. We are social distancing. We can protect you in hospitals. So we need to encourage people, if they are concerned about their health, they do need to come in. I've spent most of my career dissuading people from coming to A&E, and now I think it's the opposite. We need to encourage people to come back to A&E, to go to their GP, to come to hospital if they are concerned about their health.
How prepared are you, Debbie, about capacity if there is a second wave?
So I think the thing that we are very clear about is being on standby for any further spikes. If there is any particular surge or a local outbreak, we have got our staff on standby on the facilities. We've all learned so much. And of course, we've had some good news as well about the treatment for COVID for the very seriously ill with dexamethasone. So that's really good news. I think that the challenge for us is to make sure that we can use all our capacity to maximise the routine care. So we've got everywhere with social distancing and stronger infection prevention and control, we don't have as much space. So a 6-bedded bay now has to turn into a 4-bedded bay. Things like that. We have to keep some beds on standby in intensive care. So there's a space issue and a staffing issue. And then, of course, the greater complexity in making sure that we do more testing before people come in and that sort of thing. But we are well prepared. But it's not a quick fix. That's the trouble.
And finally, Nick, what about the pressures on A&E? Obviously, as you said, the attendance is way down, but I've reported from your hospital in Ipswich about the kind of pressures that you normally get during the winter. Is that likely to be an issue again with the twin pressure of coronavirus?
Absolutely, we are preparing for that. Our normal winter planning, of course, now includes a degree of looking at what might happen with COVID, but of course just simply managing the flow into A&E. If people have got to sit either way, even if it's 1 metre apart, if that does change, then we can't just have an open door policy at the front of A&E. So what we're looking at is a kind of talk before you walk. So we encourage people to phone up, to triage them on the phone, so that we can manage the number of people coming into A&E just in terms of keeping them safe and keeping our staff safe.
Nick Hume, Debbie Fleming, thank you both.